learn about the ICD-10 coding classification for the diseases of nervous system. So in this video, you are going to learn about the systemic atrophies, which are code ranges from G10 to G14. So what it is? So these ICD-10 codes describe a group of diseases where nerve cells in the brain and spinal cord slowly deteriorate. So this deterioration is called as atrophy. So what do you mean by atrophy? The meaning itself, it says the nerves shrink or the nerves stop functioning properly. So what body functions are affected? So these nerve cells control the movement, coordination, balance and the thinking function. So these problems gradually worsen over time. So why do these diseases happen? Most of them are the genetic one or the hereditary. Nothing but they have been passed on over the families. So they are progressive, meaning they get worse slowly over years. Progressive nothing but getting worse over the years. So what is G10 code? It's a Huntington disease, right? So what do you mean by Huntington disease? It's a hereditary brain disorder. So this happens because of the mutation in the HTT gene. So what happens over here? As the parts of the brain gets shrink, the ventricles become larger because the surrounding brain tissue shrinks. So what does this causes? It causes the uncontrolled movements, difficulty with balance and also the coordination. You can also feel the changes in the mood and behavior. There will be a problems with thinking and memory, right? So coming to the picture of the normal brain and Huntington's disease, you can see the clear difference. So in normal brain, the brain has ventricles, right? You can see which is in brown color over here. So these are normal in size. So this basal ganglia is healthy and full. Here the brain tissue appears thick and normal. When coming to Huntington's disease, here the certain parts of the brain begin to shrink. So they begin to decrease the size. So this is called as atrophy. So here the nerve tissues gets damaged and they stop functioning properly, right? So in this picture, you can clearly see the ventricles are enlarged. The ventricles look bigger. Why it has happened? Because the brain tissue surrounding the ventricles is shrinking. So as tissue gets lost, the fluid space becomes wider, right? So this is atrophy. So in this, it especially affects the basal ganglia. So this one is the basal ganglia, right? Here the basal ganglia is completely disappearing. So this affects mainly the basal ganglia. So these areas appear smaller, thinner and also less dense in this image. So what does this mean? So because the basal ganglia shrink, the movements become jerky or uncontrolled. So the person may have balance and coordination problems. Thinking and also the behavior can also change because of the overall brain tissue loss. So in this you have clearly learnt about the how does the normal brain look and how does the Huntington's disease brain look. So next coming to G11 code, it's a hereditary ataxia. So what do you mean by hereditary ataxia? Ataxia means it's a loss of coordination. So what do you mean by hereditary? Nothing but these are the genetic disorder. So a genetic disorder where the brain and nervous system, it slowly loses the ability to control movement. This is called as hereditary ataxia. So what gets affected by hereditary ataxia? It may be a walking, balance, speech, eye movement, eating and swallowing. So what is a billable subcode over here? G11.0. It's a congenital non-progressive ataxia. So what do you mean by congenital? I already said you in before sessions, congenital means which is present over from the birth, right? So ataxia which is present from the birth and which is not progressive means it doesn't get worsened day by day. Okay. For example, when you take a 40-year-old patient, he developed the choreoform movements like a dance like uncontrolled dance like movements and also the positive genetic test. So you have to assign the code G10 and also as well as the G11. So these are the ataxia symptoms over the right side of the slide. What are the symptoms? Lack of coordination in the brain. You can also find the eye movement abnormalities, the slurred speech, trouble eating and swallowing. You can also see the heart problems, the tremors and deterioration of the fine motor skills. I already said you the motor nerves have been getting damaged and the gait abnormalities and the difficulty walking and the poor balance, right? So next coming to G12, it's a spinal muscular atrophy and the related syndromes. So what it is, the spinal muscular atrophy is a group of genetic conditions where motor neurons in the spinal cord degenerate. Degenerate means they die. So this causes the progressive muscle weakness. So what happens when spinal muscular atrophy occurs? The muscle becomes weaker, the movement becomes difficult, breathing and swallowing may also be affected, right? So what is the billable subcode? G12.0. So whenever the patient is diagnosed with infantile spinal muscular atrophy type 1, you have to assign the code G12.0. So this is a severe spinal muscular atrophy disease seen in infants. You can regularly see this in infants. So this causes very weak muscles and also difficulty in breathing and feeding. So this is about the G11 and G12 codes. So next coming to G13. What is G13? It is simply used when the brain or spinal cord degenerates because of the another disease. Here you can see the spinal cord degeneration, but the underlying disease is the other disease. It is not a primary neurological disorder. So the nerve damage happens secondarily due to something else. For example, when you take a cancer, so due to cancer, the nerve damage happens secondary, right? So what is the subcode over here? It is G13.0. It is a paraneoplastic neuromyopathy. So what do you mean by it? This occurs due to cancer. The immune system, while fighting the cancer, it mistakenly attacks the nerve. So what it causes whenever the nerve system get attacked, so it causes the weakness and also the nerve damage. So this results in the paraneoplastic neuromyopathy. What do you mean by neuromyopathy? Neuro means nerve, myo means muscle, pathy means disease, right? So whenever systemic atrophy affecting CNS in the disease caused by the underlying one, you have to assign the code G13, right? And next coming to G14. So what do you mean by G14? Post-polio syndrome. So what do you mean by post? After. So people who had polio many years ago and they can develop new symptoms later in life. So even decades after recovery, the nerves that survive polio, they become overworked and weak. So what will be the symptoms of this post-polio syndrome? There may be a new muscle weakness, fatigue, muscle and joint pain, difficulty walking. So what is the subcode? G14. It's a post-polio syndrome. There are no subdivisions. There is no subcodes again. It is only a standalone code. So whenever a patient with history of polio develops new muscle weakness, decades later, you have to assign the G14 code. Now, it's a G20 to G26 code ranges. What does they describe about the extrapyramidal and movement disorders? So these disorders, they affect the extrapyramidal system. So what does they include? They include the basal ganglia. They include the dopamine pathways, right? And also they include the other parts of the brain regions, like they control the they control the smooth body movements. So when these areas are damaged, so people develop tremors, rigidity is nothing but stiffness, the slow or reduced movements, involuntary movements, and also the poor coordination and balance. For example, when we take G20 code, it describes the Parkinson's disease. So what do you mean by the Parkinson's disease? So it's a chronic progressive brain disorder, right? So it's a chronic brain disorder, chronic progressive brain disorder. Progressive is nothing but it's getting worse day by day. So this is caused by the loss of dopamine in the basal ganglia. So dopamine is a chemical that helps to control the smooth and coordinated movement. So whenever the dopamine decreases, the movements become slow. So whenever the Parkinson's disease is diagnosed, you have to assign the code G20. So what is the subcode? G20.A1, the Parkinson's disease without Dyskinesia. Dyskinesia nothing but it's a involuntary jerky movements caused often by the long-term medication. So at the right side picture, you can see the Parkinson's disease symptoms. You can see here an old man who develops a Parkinson's disease symptoms. What are they? A stoop posture. The posture is not good. It is a stoop posture. The masked face. You can see the reduced facial expressions, the forward tilt of the trunk, the rigid back, the flexed elbows and wrists, the reduced arm swing while walking. You can see the arm swing while walking, and the hand tremor. You can see the tremors in the legs and also the hands, the slightly flexed hip and knees, and also the shuffling, the short step gait. So these symptoms reflect whenever the movement control problems occur due to a dopamine loss. So next code G21. It's a secondary Parkinsonism. So what do you mean by secondary Parkinsonism? So it means like Parkinson's-like symptoms occur but not due to Parkinson's disease. You are getting my point, right? Parkinson's disease is occurred, but you develop the symptoms, but it is not due to Parkinson's disease. So this is the secondary Parkinsonism. So instead it is caused by the another conditions such as the medications, the brain injury, the infections and also the toxins. So what is the example of this one? G20.0. It is a malignant neuroleptic syndrome. So a severe reaction to the antipsychotic drugs. So whenever you take the medication, right, you develop a severe reaction to the antipsychotic medications. So this causes the stiffness, fever and confusion. So whenever a malignant neuroleptic syndrome is diagnosed, you have to assign the code G21.0. So what next? G22. Parkinsonism in diseases classified elsewhere. So what do you mean by this? It is used, this G22, it is used whenever the Parkinsonism, it occurs as a symptom of the another known disease. So in G21 it is not known, in G22 it is another known disease. So for example, a Wilson's disease causing Parkinsonism, you have to put G22. This Wilson's disease, it damages the basal ganglia, so Parkinson-like symptoms appear. So in that cases, you have to assign the code G22. So the next code G23, it is another degenerative disease of the basal ganglia. So what does this category includes? It includes other rare or specific degenerative disorders affecting the basal ganglia, nothing but the movement control region of the brain. Right, the basal ganglia is the movement control region of the brain. So G23.0, it's a Haller-Walden's disease. It's also called as PKAN. So this is a rare genetic disorder that causes the iron buildup in the brain. So whenever the iron is built in the brain, it causes the movement problems, right? So it results in the degenerative diseases affecting the basal ganglia. So whenever the movement problem takes place in the brain, as the basal ganglia is the movement control region of the brain, so it gets affected. So this is about the PKAN. Now next coming to G24 code, dystonia. So dystonia is nothing but it's a movement disorder where the muscles contract involuntarily, right? So causing twisting movements, abnormal postures and also the repetitive muscle contractions. So what is the important subcode for dystonia? It's G24.0. So drug-induced dystonia, when medicines like often we take antipsychotics or anti-nausea drugs, right, for dystonia. So whenever we take the medicines, they causes the dystonia. So what will be the symptoms of dystonia? Here you can clearly see a picture of the symptoms. The involuntary muscle contractions, the pain, the tremors, postural abnormalities, the speech difficulties, and also the swallowing difficulties. So whenever a drug-induced dystonia is diagnosed by the patient, you have to assign the code G24.0. So next G25. So what does G25 include? It includes the other extrapyramidal and movement disorders. So what are the other involuntary movement disorders? They may be a tremors. Tremor is nothing but a shock. They may be a tics. Chorea. Chorea means a jerky dance-like movement, and also the other involuntary movement disorders. So they do include the myoclonus such as sudden jerks. So what is the important subcode over here? It is G25.0. It is an essential tremor. So essential tremor is nothing but it's a common condition where the hand sometimes like head or voice shake. So without another disease causing it. This is about the essential tremor. So you have to assign the code G25.0 for essential tremor. So next G26. G26 is nothing but it's an extra pyramidal and the movement disorders in diseases classified elsewhere. So it is used whenever the abnormal movements are caused by the another disease, like another underlying disease. For example, when the movement problems occur due to brain infections, when the movement issues occur due to metabolic disorders, and the Parkinson-like symptoms caused by the another neurological disease. So G26 is never used as an alone, right? So it is linked with the main disease causing the movement disorder. So this is about the extra pyramidal and movement disorders caused by the underlying diseases. So for example, chorea caused by the systemic lupus erythematosus. So chorea is nothing but it's an involuntary dance-like jerky movement. So when these movements are caused by another disease like SLE, you have to assign the code G26. So G26 is for extra pyramidal movement disorders that result from the another underlying condition. So next we shall learn about the other degenerative diseases of the nervous system. What is the ICD code ranges? G30 to G32. So what does these code ranges do? These codes are used for the diseases where the brain of the nervous system slowly deteriorates, slowly damages the brain over time. So what does they affect? They affect the memory, they affect the cognition, means thinking, they affect the coordination and also the motor skills. Usually they are the chronic, so they are the long term, they are the irreversible, they can't be reversed. So they are also the progressive, means they worsen day by day, they worsen over years. So for example, coming to G30 disease, it's an Alzheimer disease. So what do you mean by Alzheimer? Alzheimer disease, it's a chronic progressive neurodegenerative disorder causing the dementia due to accumulation of the amyloid plaques and the tangles in the brain. So what it is, it's a progressive brain disease causing the, you can see the loss of memory, you can see the poor thinking and judgment, you can also see the behavioral changes and also difficulty in performing the daily activities. So these are all the symptoms of the Alzheimer's disease. So what is the billable subcode of Alzheimer disease? G30.0 for Alzheimer disease with early onset. Right. So what do you mean by early onset and late onset? So what is the difference between G30.0 and G30.1 code? Early onset is nothing but symptoms start before age 65. Whereas late onset, nothing but symptoms begin after age 65. So this G30.1, the late onset, is the common type of the Alzheimer disease. So when coming to early onset of Alzheimer disease, so it often it is in the faster progression. So it worsens very fast, right? Sometimes due to genetic factors also. When coming to G30.1, it is a genetic one, it is a neurological one. So it generally begins after age 65. It's the most common type. So for example, whenever a patient gets diagnosed with dementia beginning before age 65, you have to code with Alzheimer disease with early onset because it is before age 65, right? You have to assign the code G30.0. And next coming to G31 code. So what it is, it's a other degenerative disease of the nervous system, not elsewhere classified. So what does G31 code mean? This code is used for the brain degenerative diseases that are not Alzheimer's. and they don't even fit into the other special categories, right? They are not Alzheimer's and also they do not fit in the other specific categories. So those type of diseases are classified under G31. So these conditions, they cause the behavioral changes, the language problems, the personality changes, and also decline in the thinking abilities. So what is G31.0? It is a frontotemporal dementia, is nothing but the Pick's disease. What do you mean by FDD? Nothing but a degenerative disease affecting the frontal and temporal lobes of the brain. You have the four types of lobes in the brain, right? So this FTD, it affects the frontal and temporal lobes of the brain. So what does this two lobes control? They usually control the personality, behavior, and also the speech and language, right? So these areas get damaged due to this degenerative disease. So what are the common symptoms of the Pick's disease? You can see over the picture at the right side. The common diseases of the Pick's disease are difficulty in keeping a job, abrupt mood changes. You can also find the compulsive behavior, a poor social skills, a repetitive behavior. These are all the examples of the Pick's disease symptoms. So you can also assign this code whenever a patient shows a major behavioral changes, and also they have the difficulties in language or speech. So this is about the G31 code, right? So next, coming to G32. So what is a difference between G31 and G32? In G31, it's the other degenerative disease, but they are classified elsewhere. This is the diseases, whereas G32, these are the disorders, right? So there will be a difference between diseases and disorder. So this G32, it is used when the degenerative change in the nervous system is caused by the another disease. So it is not a standalone condition. It is a secondary to a primary disease. For example, when a nervous system degeneration caused by a HIV infection, you have to code G32 code, right? So what is the meaning over here? HIV infection is the main cause, but nervous system degeneration is the result. So HIV is the primary diagnosis and the nervous system degeneration is the underlying disease, underlying condition. So you have to assign the code G32 over here. So what do you mean by the abrupt mood changes in the symptom of Pick's disease? Abrupt mood changes is nothing but the person may suddenly become angry, sad, excited, or irritated. So mood switches between happen without a clear reason. So coming to compulsive behavior, this repeating certain actions again and again. Compulsive means repeating the actions. So doing things without thinking about the consequences. So poor social skills, nothing but they do not understand the social rules. They have the difficulty in understanding the social rules. So they also do the inappropriate things, a lack of empathy, and also the emotional response. So repetitive behavior is nothing but perform the same task or the activity repeatedly. For example, tapping, pacing, and also repeating the words. So difficulty in keeping a job. So due to behavioral changes, a poor decision making and lack of emotional control occurs. So what does this happen? A work performance get affected, right? So this work performance drops because the person cannot manage the responsibilities properly. So why do these symptoms occur? Because the frontal lobe and the temporal lobe, which are meant for behavior, judgment, language, and emotion, so they became damaged, so leading to the behavior and the personality changes. So these are the symptoms of the Pick's disease symptoms, Pick's disease disorder. And also you have learnt about this G32. So when to assign G31 and when to assign the G32. So this is all about today's session. In the next session, you will be learning about some more ICD-10 CM disease classification of the nervous system. I hope this video is helpful for you, and thank you.